there's so many different losses that add up. And so if we don't have the ability to internally repair all of those hopes, dreams, and expectations, then we carry it.
You introduced me to grief recovery work, which maybe we could give it different names, but it's really how I have become a master of reframes.
Yeah.
And how I've guided like 10,000 women through women's health. And I always credit you. I put you in my book. But what a privilege and honor it is to be able to talk to you today and to hear what inspired you to practice this way and how we can share that and help as many women as possible.
Okay. You know what? It's actually, this is the first time that I've seen your dream in this state of this fruition over the years. And it's just inspiring and really honoring in my heart.
Oh,
Yeah.
Thanks. Thank you so much. And
Yeah.
and truly, with the knowledge that I was able to, or the wisdom, what you call it, that I got from session after session with you, it gave me the ability to kind of create a niche practice where I have a reputation of being able to help with the emotions. And I don't have any psych background, but that is my thing. And that is all from sitting across from you in therapy, even now. So I wanted to open up the conversation by saying that when I first came to you, it was for a codependent relationship, who now is the kid's dad, ironically. But that being said, you jumped in and said, "Are you ready to do the dad's work? Or I think you should do some dad work." And I was like, "What are you talking about?" And you said, "With respect to grieving." And I was so confused because he was still alive. And that made no sense why we were going to do grief work on someone who was still alive. So can you expand on what you were thinking back then or how it rolls now?
I'd be happy to. You know what? I'll start with kind of what got me, aware of grief is in my last semester in grad school as a therapist, or learning to be a therapist. My mom died from cancer within 16 days from what we had been notified, and that turned my whole entire life upside down and inside out. And I had a whole series of losses right after that, because there's primary loss and then there's all these secondary losses as well. And so I started seeing grief everywhere. I was working in a psych hospital at the time, as well as doing private practice. And I started sitting with clients, with patients at the hospital, and getting their history and hearing that more often than not, I'm going to say 98% of the time, when people have hit a crisis and they come in for some help, or that they have to be hospitalized, is that when we look at their history, there is always, always, always grief involved. There is always a loss or a series of losses that have just, made the world so incredibly hard to navigate. And when I look at it from that way, and I also started getting more training. It's actually, I was in my own therapy, and we've talked about how, I think that there's such a lack of training in the therapy world for recognizing grief. I now am a adjunct professor over at Pepperdine, and and even though it's a practicum class, I always tell all my students first week, you've signed up for a practicum class, but unbeknownst to perhaps some of you, you've also signed up for a grief class, because I can't teach this work, and you will be able to do this work much more effectively when you can start recognizing all of the grief that is interspersed in our relationships, in our struggles.
Yeah, I think that's...
Which I think, by the way, is actually much more of a wellness model than a medical model.
Sure, because wellness can see how things crash and burn based on how things have been going all along, the setup for that, where medical model might be, okay, here you are, this is the problem, let's address it right now, or let's prevent you from dying kind of thing. Like it's two different ways of looking at things. So when
in the mental health field, then there's diagnoses, and the shame that goes with that is that when people come to see us at our counseling center, there must be something wrong with me. I feel crazy. It's like, no, your whole entire world turned upside down and inside out. And it's such a multifaceted, multi-layered set of reactions.
Right.
Yeah.
Because in the West, we're not really taught to expect things to change and end. You told me once, all relationships have one of two outcomes. They either end or change. That was so profound and so true. And it's funny because I just passed one of my patients in the hallway here at the clinic, and she is somebody who has a kid after doing cancer treatment. And her ovaries were completely suppressed, but she used the seed program and she got these eggs. But it wasn't just that she changed her diet. I kept pushing and pushing. Can we do the cancer work? Like you said, can we do the dad work? I said, can we please look at what caused your cancer in the first place? I know it's hard to believe that it will help your eggs, but it's really important work. So I'm hoping to get her on the show.
Good.
Yeah.
Good.
So let's back up. Let's just give some credit to John James and Russell Friedman, who wrote the Grief Recovery Handbook, because that was what you said. Here, Danica, take this and it'll kind of start making more sense.
Yes.
So how they create that exercise of the timeline, that's really feeding into what you're saying, this cumulative losses. So how wonderful that your students are going to just be given that work.
Yeah.
Right?
Yeah.
So,
and you know what? And I have to say, in my own grieving heart, my brother died a few years later from cancer. And I went back to the therapist that I had after my mom died, who basically said, it just takes time and you have to go through all these stages. And I kept thinking there was something wrong with me, because I was like, I don't think this stuff is really working.
And I'm not feeling better over time.
No, that's right. In fact, actually, with time, it can often get worse because there are so many different losses: loss of identity, loss of social support. There's so many different losses that add up. And so if we don't have the ability to internally repair that, all of those hopes, dreams, and expectations, then we carry it. And one of the meanings, the root meanings of grief, is heaviness. And another root meaning actually comes from the French word gref, which means injustice.
Oh, wow.
And
that's such that word right there sums it all up.
Yes.
And here we are.
The unfairness.
Right. And now, aren't we a society of injustice from one way or another?
In so many ways.
So we can recognize that, but can we start honoring the power of doing grief work?
Yep.
It sure would be great if we could.
Yeah. Yes, it is. And here's what's really, really cool. What's so cool, even over the time that, that I first, you and I first met, is that the options for getting good grief support and tools has expanded at, I don't even know how many times over. It is amazing. Years ago in the mid-90s, there was like half of a shelf. Now there's entire sections, and one of my entire bookcases in my office is filled with nothing but grief books. Your book actually is on there as well. Yeah.
That's great. Yeah. Well, I was one of the brave ones who said, we need to talk about this.
Yeah.
Do you know how many fertility clinics I've been to and they don't even have a box of Kleenex tissues for the patients?
Yeah.
That's so dismissive of the feelings that are involved.
Right.
So in Chinese medicine, what bridged everything for me was where I learned that the uterus is a second heart. And you had always referred to the heart as a processing tank or a filter.
Right.
And that connected the two pieces for me.
Yeah.
So basically saying that if that energy of grief isn't transformed, then it's going to cause problems.
That's right. And if it's not recognized, if it's not even seen, there's a type of grief that we refer to as disenfranchised, which is it was a term that Kenneth Joka had created, I think, in the mid-90s, which was really about losses that are unacknowledged and are taboo to talk about in our societies.
Kind of like miscarriage, maybe?
Exactly.
Because so much shame and don't talk about it because you might as well be saying I've got some venereal disease or something that.
Yes.
Kind of thing.
And so much discomfort with, I don't want to go there and I don't want to remind you
or I don't want to make you feel uncomfortable.
Exactly. Which is really about, it's uncomfortable for me and I don't know how to tolerate that. And so being able to help people recognize that helps them realize, oh, wow, maybe there isn't something wrong with me. Maybe this is about what we've been taught. And that teaching is so integral, it's so insidious in the way that we language grief or don't language grief.
I thought that was one of the more powerful aspects of the Grief Recovery Handbook was where they identified they said, we have myths around grief and they wanted us to identify what are some of the myths that we've been told. Right. And these myths look like, don't worry, or you can always replace the loss. Right. There's plenty of fish in the sea. You need to be, or I need to be strong right now.
Yeah. Look at the phrase of at least. At least, you can get pregnant.
Oh yeah. At least you're still young.
Exactly. And so that's so incredibly minimizing. Right. From, and here's what's confusing is that it comes from people who mean well.
Yeah, they're well intended.
Who want to be able to support and they just don't know what to say. It would be much truer if they said, I have no idea what to say.
Right.
Yeah.
But I can sit in this with you or I can offer a hug
or not emanate that this scares the bejesus out of me and I'm ready to run out the door, which then gets translated as, see, there must be something wrong with me.
Right.
Yeah.
I think we also are living in a society that's become a little bit judgy. And so there might be some thoughts
lots
of
judgy.
I guess in as old as time, but it's kind of
and I think sometimes it's not meant to be judgy. It's meant of here's some advice because, I don't know what else to say. So here I'll give you some advice or I'll tell you all the reasons why it is that you shouldn't be feeling the way you're feeling, which is invalidating.
Yeah. Invalidating. Yeah. Right. So to bring to awareness that we've been misled or uninformed or misinformed, it kind of explains how by the time a woman shows up for acupuncture for fertility, whether she's had a miscarriage or not, she's carrying the heavy and she has a lot of emotions, grief. So in Chinese medicine, we talk about emotions, joy or the lack of joy, anger and frustration, worry. But grief is a catch-all.
Yes.
Because you taught me it's all the things.
Exactly. So I've got a really great definition that I want to share with you.
Okay.
I have to look at my phone because I had made sure. Actually, grief, using my words, is that it's just such a complex emotional and physical and spiritual set of responses to significant loss. into loss that looks like it's no big deal, except that all of that gets accumulated.
Yeah.
And we carry that around without even realizing the weight of what we're carrying.
Yeah. Yeah. Another thing to identify loss is it's a change from how it always was, or a change from what you thought it was going to be.
Yep.
Right?
Yes.
Just an aside, did you find your definition?
Yes. So I have actually another definition of loss. It's actually from encyclopedia.com. A loss occurs when an event is perceived to be negative by individuals involved, and it results in long-term changes in one's social situations, relationships, or way of viewing the world and itself. I think it's actually not even or.
And
death is the event most often thought of as loss, but there are so many others. Yeah.
Right. Yeah. Divorce.
Yes.
Getting married. You explained to me, getting married is a loss of your freedom.
Exactly.
And a big change from your status.
Right. Well, and there's so many, birth of a child, right, is this very joyous occasion, except that hormones are all over the place and it's frustrating.
And the mom loses her freedom if she's breastfeeding. Right. She's now got to stop what she's doing, sit down and nurse or pump. That's a ripple. Yeah. I think we could say that, right? Yes. With respect to grief, the rippling.
Yeah. Well, there's the primary loss and then there's so many secondary losses.
Right.
Too.
Right.
Yeah.
But I think the emphasis being about it is a part of life. Having just lost my dad, I am getting, as that gets out, people are sending me condolence texts and I'm able to say, but it's a part of life. I wasn't that surprised. I just wasn't expecting it to happen last week.
Yeah.
And so there's that, but then now there's the sorting through his things and thinking wow, I'm not going to talk to him again. Yeah. And how relationships are changing with the rest of us that are alive without my dad in the picture.
And the finality of that.
Yeah. Right. So because we're baby makers here, let's move the conversation to how do you use grief when you're working with women that are trying to conceive or if they've had habitual loss?
I want to find out what their whole history of different types of losses that they've had, because we don't have a history. And that's what I really love about using a timeline. Is because it's visual, and so it's actually processed differently.
It goes into a different part of their brain that says what I'm doing makes sense, and if it makes sense, then we can
visually see it.
Agreed.
Yeah, and then I'm also listening for all of those different types of losses. I'm usually listening for how isolated has this person been. I like to ask, did you have anybody there to be able to talk to at that time? Was there anybody when you went through that experience or this experience who got it, who you were able to talk to? I also think that we have a lot of different unfinished conversations or conversations that never happened for so many reasons. They're not available.
Well, especially in a miscarriage.
Right. There was a patient.
There was a patient who stood up, walked out of my room when I said, listen, because she wanted to take on the blame so much. And it's hard to forgive ourselves. But then I really took it to a place she didn't want to go when I said, do you think you could forgive that embryo or that baby for not being strong enough? It was at that point just a few hundred cells.
Yeah.
And she was like, are you kidding? No, this thing did nothing wrong.
Right.
But I was wanting her to see that if she could, it actually makes it easier for her to move forward and for her to look at it differently. She wasn't ready. That's all it is. No judgment. It's just like we mature at a certain pace with the things that happen, and that's how we're able to integrate.
Right. And it's our own willingness.
Willingness, yeah.
Yeah. Yeah. and that, what, I think all the guilt that comes up, all the woulda, coulda, shouldas, all the blame and self-blame, it is really about feeling helpless. And really, as human beings, we just don't do helpless well at all. We just don't.
Right. So when you ask them, what are you willing to do to feel better or to let grief consume you a little less?
Right. Well, and that willingness is that we have to do a whole lot of education before I even get to that.
Exactly.
Of what's the stuff that you wish you had done differently? What's the stuff that you wish the other person had done differently, which can be also medical community or friends or family, or the stuff that they didn't do, okay? Stuff that they wish their partner had done. And then all of the unexpressed appreciations and gratitude. That is really, that we're told, you should just be grateful for.
Right.
And the problem is that it's expressed of, here's the reason why you shouldn't be feeling the way you're feeling.
And here's where you messed it up.
Right.
Here's where you're the one to
that
blame.
way.
Right. It's kind of like telling the couple struggling to have a baby that they just need to relax or they just need to go on vacation.
Right.
It may be entirely true that they're upregulated and changing that would change things.
Yeah.
But as a directive, it really doesn't land well.
No.
But in the context of helping women, in particular, that's who I work with.
Right.
Helping them to reconcile when that word you taught me, the reconciliation, where it's like, okay, where can you take some responsibility for how you're going through this and to get that rest of the conversation out in the open, then those gratitudes and the willingness statements, they naturally come through. But if we present them to them, then they can feel like there is something they could do.
Right. Well, and that is empowering, especially when this is such an incredibly paralyzing, hopeless, helpless experiences. Yeah. Yeah. And I think being able to help them, help them identify the words that they'd want to communicate is really important. It's not about putting words in their mouth at all. It's about listening for what their heart needs to say and that didn't get to say. And so I think that with children that didn't come to fruition, in so many different hopes and dreams and expectations, then if we give them some language of what would you want to say, let's look at what's the stuff that you are feeling guilty or feeling bad about. And can we teach children to apologize, which is about accepting responsibility for your own stuff. It's not about blaming the person. The thing is that they're already blaming themselves.
Right.
Right. And, what's the stuff that I tend not to use? I tend not to use the F word, forgiveness. I use the other F word a lot. But I tend not to use the forgiveness word because it's so misunderstood. And, it goes along with, I agree, or I'm letting you off the hook.
Or I'm better than you. And I have said that, okay, I forgive you for that. And I'm making the call. I am the righteous one.
Right.
That is so wrong.
Yeah. Well, because we also have to take a look at, at our part, but also being able to acknowledge the resentments was really about acknowledging where's the hurt. And can we talk about, here's what happened. Here's all the significant emotions that were attached, and be able to then make a release statement of, and I choose not to hold on to this pain for the rest of today. Okay? And that whole release work is profound.
Yeah, it sure is
profound.
It sure is. So I took the work that we did and I really ran with it, as you know.
Yeah.
Using those tools, I created a binder, my grief binder, and I reconciled every single relationship, every romantic relationship, the mom relationship, the dad relationship. And as a result, my heart was really open. It didn't mean that I was, I want to say that as I opened my heart more from doing that work, I was a little bit more open to the idea of having a baby with an ex-boyfriend and being open to seeing how that would play out, because I wasn't more clarity and more ability to be in the present moment.
Yeah.
There was a day where you scribbled the little person, the stick figure with the frustrated face, and he was holding on to the past
and the future.
The future. And there were no bars blocking that person from moving into the present and being in the present. If you can just let go of, if I could let go of what happened between him and me in the past and let go of the worry of what it might be like in the future, then I could show up in that moment and see what would happen after having used herbs for my ovaries and acupuncture for my nervous system, some change of diet. And there was Kira. And even more true to conceive Jack, where I had that blocked fallopian tube. I didn't know I was ovulating on the blocked side, but I was able to ask myself, what am I willing to do? Am I willing to try this again? Am I willing to look at how well things are going for the three of us with Kira and to see that it's good enough? It's good enough.
Yeah.
And that was on me.
Yeah.
And to release that attachment to how it should look and all of that was very freeing.
Yeah.
So thank you for giving me those tools.
I also, and I know you've heard me say this in the past, is that I don't ask anybody to do work that I haven't done myself.
Right.
Damn it.
Right.
And, and I went through 9 years of fertility struggles, in different ways of my body. I'm a DES daughter. My body didn't work that way.
There was a structural problem in the uterus.
It was structural. It was, quote, unexplained infertility, which feels even crazier because it's like, how can we find, quote, the reason, which there isn't usually one at all.
Well, and if it is a DES uterine anomaly, you can't really know that until you've had losses.
Right.
Right?
Right. Yeah. And we went through trying to adopt, and that fell through. And then actually one of my sister-in-laws agreed to be a surrogate for us. And the third time, when the third insemination didn't work, that was like year 9. And I said, my heart was so incredibly heavy. Both Mark and I were exhausted because grief is exhausting, and I remember the power of, I had to have the willingness to do that work, to say I have to release all the pain over the years, so that I could have a lot more clarity of what I wanted to do and where I wanted to go in my life. And what opened up after that was beautiful, is really being able to actually take that energy of nurturing to communities, to my clients, to teaching, to programs that I've set up in teaching clinicians and healers. Yeah.
So it was another example of you being called, like having the personal experience, and instead of like in my situation where it worked out and I on a daily have to reconcile that this is how it worked out, on the daily you reconcile that it worked out differently and this is how you roll with it.
Right.
But integrating,
I think
the loss of the
creating meaning.
dream.
Right.
Mm-hmm.
Yeah.
Like I had a romantic dream.
Mhm.
You had the dream of being able to nurture.
Yeah.
But you've continued to nurture and I continue to reframe.
Right. Well, reframing, I think, is re-educating people.
Mm-hmm.
It looks like this. Maybe it also looks like this.
Mm-hmm. To
Too.
give permission.
Maybe it has different meanings.
Right.
Yeah.
And to see the joy that is hard to find sometimes.
Yeah.
Or sometimes you have to create it yourself and tell yourself that.
Yeah.
That must have been. So did you have?
I think there's also guilt that comes along with the joy, is that people will talk about, I think I'm doing better, and will present it that way. I think I'm doing okay.
Meaning that they feel like they should be grieving for a certain amount of time?
Yes.
You mean?
Is that, there must be something wrong with me because the okayness feels uncomfortable. The okayness feels disloyal.
Mm-hmm.
And when we can normalize that
Mm-hmm.
of, if you're not in pain, it doesn't mean that you don't love the person.
Right.
Yeah. It doesn't mean that you don't have a continued relationship with them. Is that I think being able to help people strengthen their tethers of the emotional relationship that they get to continue having with that being, and for some people, the spiritual relationship.
Mm-hmm.
Yeah.
Well, you know how it plays out sometimes in a very unexpected way in the fertility community is that the patients are working with these clinics. They develop relationships with the nurses, the doctors, the agencies that are involved, if that's the case.
Yeah.
And this goes on. This is 2-3 years of their life. And then when that's done, they graduate, but then they're so full of different emotions. Most top of the list would be anxiety. They're anxious to leave.
Absolutely.
But I'm able to kind of like help them to see that there's some grief in moving beyond those relationships.
Yeah.
Even like the loss of a surrogate in your life, because that becomes a familiar. And then we come back to the definition of grief, the loss of the familiar or a change. Mm-hmm. Because they don't think in a million years I'm going to be sad to leave the fertility clinic.
Right.
Or feeling sad to not have to check in on the weekly with the surrogate.
You know what? I'll share a true story that somebody shared with me recently, is that they had a very frightening incident that had happened at the hospital, and it was near fatal. And they are actually 95% recovered at this point. This person and their partner went back to the hospital for something else, and the person that was there for 11 hours that day that this person almost died, the impact of being able to see this person afterwards of, oh my gosh, you're okay, and was able to share this incredible video that this nurse and other people on that team had created, and it was just beautiful. The hospital actually invited this couple to come back, and they were able to talk to the whole treatment team.
Wow.
So, and such incredibly powerful work, and really not realizing the power of the community that helped them through that, and what impact they had on them, and how their experience changed everybody there at the clinic, at the hospital.
Right.
Yeah.
Everybody likes being seen in that kind of case, but I'm also hearing the power of coming full circle.
Yes.
And how important that is to be able to say thank you, and especially coming so close to death. Yeah. I don't know why this is feeling like the next thing to say, but the goodbye. Like that couple, they didn't have to say goodbye to each other, but
neither of them are the same anymore.
Right.
It changes our identity. And what are we saying goodbye to?
Right.
And it's often saying goodbye and releasing the pain.
Exactly. I think that's why I was feeling like, oh, this is a goodbye kind of thing. If we can help the patient say goodbye to a former set of embryos or one that was lost, or like in my book where I mentioned the woman came to me, she walked in the lobby and I said, "Oh, are you here to conceive number 2?" And I had no way of knowing that she was going to tell me yes, because number 1 died in the pond. So 8 IVF attempts later, as her uterine lining wasn't proliferating, she couldn't get to a successful IVF outcome. She then thought, oh, I remember the way I felt when I worked with Danica to conceive that first one. Maybe that's the thing that could be a pivot. So she came in, we did some grief recovery, and on that 9th IVF, now maybe it's a numbers game, maybe it was the emotions changed, but she was able to say goodbye to the one that passed on. And
to acknowledge the meaning of that relationship. And sometimes the relationship feels like we're grabbing at a cloud.
Right.
But it's a very true, real relationship. And
she also needed to look at the fact that the nanny thought the baby was in bed for the night or with the parents, right? Nobody knew the little one had wandered off. So you said you don't use the F word, but in that case, she found a way to forgive herself for letting the baby wander, forgiving the baby for wandering, and forgiving the nanny. But what would be an alternative to forgiveness? It's the releasing of resentments.
It's really just choosing acknowledging what the other person did or didn't do, and acknowledging all of the emotions attached. Because often when we try to even say that to somebody else, is that their response can be, "Oh, no, it was no big deal," or "You could have had another one," or it's minimized. And then it's basically the message is given of, it's not a big deal. And so the acknowledgement is about saying, I need to acknowledge that this was a big deal, that this had emotional weight to it.
What a great alternative to saying, I forgive. Instead, like, I acknowledge that this happened and it really rocked me.
Yes. And I get to be able to choose if I want to keep that or not.
The feeling.
If I want to keep the pain of that.
Right.
Okay? Of being able to help them with, and sometimes it's, and I choose not to obsess over the rest of today. Okay? Sometimes it's, and I choose to release my pain about this today.
To get into the present moment, to keep the heart open. Right. Grief work sure feels different than traditional therapy, doesn't it?
It is. And here's what's really, really, really cool about doing this for the last 30 plus years, is that I get to see so much growth, and that therapists actually really want to learn more about how to address and help their clients deal with grief, and include that in their own training. I started a Facebook group for therapists in 2018, and because I'd have lots of people that would refer over to me or my counseling center, and they'd say, but I don't do grief. I'd be like, are you kidding?
You're doing grief all the time.
Exactly. There is grief in everything that people bring to a therapist or healer. And then 2020 happened.
Right.
And then, I had a whole lot of clinicians going, oh, maybe I need to learn about this. Yes, because it's everywhere, but it's just more obvious.
Yeah, it was everywhere before then.
Exactly.
But it was really, especially COVID being a lung respiratory virus, right? And in Chinese medicine, the lungs are all about, the emotion associated with the lungs is grief. And we were all actively grieving.
Exactly.
And then we were wearing masks. And so then we weren't effectively breathing. And then we were becoming more anxious, which then was a set of feelings. And then we couldn't really talk to one another.
That's right. That's right. So in this group, this is really cool. I am amazed. I think I have almost 4,200 clinicians from all over the entire world in this group. And this private practice grief. And it's such an honor. I started doing consultation groups. I had left the Grief Recovery Institute in 2012. And I wanted to expand. It's like these tools are awesome. And there's a whole lot of other tools also.
Right.
And so I started by doing consultation, meetings with other therapists, and actually really I invited them because I'm like, want to find out, well, what are you doing about grief? And it very quickly became, I don't know, what are you doing?
And that was the grief lady. That was the queen of grieving.
Exactly. And so, so then I just started taking a different topic each month when we meet, which is how I built, my interest in all these different resources. And so I have to say, every time that I create another, or update my resource lists, I have resource lists on pregnancy loss. I have resource lists on adult parent loss. I have resource lists on suicide loss or overdose. Is that what's really, really cool now is there's more and more resources every single time. Every year that I go and update that, it's like, oh, I had no idea. Here's this other book. So a lot more people are talking about it. A lot more people are acknowledging it. Yeah. And there's so many ways. EMDR is eye movement desensitization reprocessing. EMDR is such an amazing tool also to help people deal with the unfinished business, with all the unfinished conversations, with traumas, and whether that's what we call big trauma or little trauma. It's still trauma, which is completely interspersed and intertwined with grief. You can't do trauma work and ignore all the grief of the relationship that changed and didn't come asunder. And this is also, loss of safety, loss of trust, loss of right to be respected.
With EMDR, the patients are able to integrate, like the way I understand it is the two hemispheres of their brain by tracking the a light or a finger, something, but going from side to side, crossing the midline. Yeah. And so how does that fix the brain? Because you've done it with me, and it's and on Kira. Remember, and I think she would be fine with me saying this on the pod, but there was a time, I think she was like 10, and the trauma for her was that she had a baby brother, and that was the worst thing that ever happened to her. And so I said, would you be open to having a talk with my therapist, Debi? And she said, sure. And we gave her that, the light box. And she then, can you tell me how it worked?
Here's what's really cool.
Because she said it worked.
Right. Here's what's really cool is that it's not us fixing the brain. It's actually allowing the brain to heal, because there is trauma, there's significant emotion, stuck in the amygdala, which is our part of our brain that says, danger, danger. Okay, here's a big emotion. And so that's what's really cool, is that it's not us fixing, it's actually allowing the person to creating safety and creating different protocols in order to access what is already there in the brain's capability of being able to heal.
So it's kind of like how acupuncture, everybody always asks me, how does acupuncture help?
Yeah,
because
that's a great analogy.
Well, we put little metal instruments, it changes the electricity. And then as a change in the electricity, the heart changes its rhythm and the neurohormones are released of endorphins that make you feel better. And through conversation, we get some oxytocin elicited. And then that's more of a bonding and they feel safe. Yeah. And so by the time they leave, like say they come in and they report that they've had a miscarriage, by the time they leave, they're smiling, we're cracking jokes again. Yeah. And so I guess EMDR, if you do it,
shifting that energy.
So you just kind of do it and do it and do it a couple of times and it hits where those little areas are that have broken apart maybe. And
well, sets the stage. We got to create safety in the first place of being able to help people access their own imagery of creating a calm place within themselves, creating, there's a light, a resourcing called light. And that goes from, head down to toes. And so it's really more about here, how can we help you learn how to regulate a lot of those emotions that are all over the place and that are so incredibly uncomfortable. We want to be able to do that first before we then start moving into reprocessing the trauma. And but there's a whole 7 phase protocol.
Yeah. So in the context of a surprise pregnancy loss, a miscarriage from out of nowhere, or a stillbirth, those types of...
And how shocking.
Yeah. And how would EMDR help with something like that?
Is in being able to access the trauma. It's all the emotions that it triggers and also identifying all of the what we call maladaptive attachment wounds that we learn of, I just need to not say anything, which taps into a lot of old learning.
I learned to just be quiet. Or something like that. If I say anything, I'm going to get in trouble.
Exactly. So getting them to really be able to identify when did you feel like that before, and in being able to hold that as well as what's the positive, what we call positive cognition, that I don't have to be strong. Actually, I have one is negative can be, I have to be strong, which means I have to bury all of this pain. Versus it's okay for me to talk about my grief. It's okay for me to have all these feelings.
Even as you
gentle.
Even as you said it, when you said, I have to be strong, because you're such an empath, when you said, I have to be strong, your voice was cracking. And then you switched into, but I have a choice, or whatever the other thing you said that was expansive.
Isn't that beautiful?
And your throat chakra opened up. This is the beauty of working with you. The nuances, right? The nuances of grief. To address the multiple many wounds that are there is through conversation, through empowerment, through giving patients tools, identifying that a loss even occurred. One other thing I wanted to talk about is the idea of how to address when they don't get the happy ending. And it's kind of where I want to wrap up the episode, but it's so frequent in my work. If I'm working on a case and they're trying and we're getting them ready for IVF, and there's a number of embryos, and we're going to go through those embryos either until it works, hopefully it works, and sometimes it doesn't work. But how can we address this idea that really what they're striving for, they've ascribed the meaning of a happy ending to having a baby or becoming a parent. So that is really what the grief work is about. It's like to not go too far out into the future, to think that that's where the happy ending is waiting.
Right.
So,
But I think that there's so much tied in. There's so many different other losses. There's loss of identity as a parent or a parent to be, or loss of identity of a parent of more than one child, and which is about that loss of identity. There's also, people can get stuck on the relationship and what did they wish had been different in that relationship. And then they can also get stuck on the event that happened. And actually that work is from Bob Niemeyer's work of creating meaning, and looking at where is the person stuck. And I don't think that it's just one area that we can help them with. But that identity, and how to be able to walk through that with support, with creating safety, with being able to address and verbalize, but actually more acknowledge all of the hopes and dreams that didn't get met, that we hold on to, often without even knowing that we're holding on to it. Okay. And can go and feel even more desperate, but it has to look this way, and lose the meaning of, wait a minute, what's the meaning of what journey that you're on? And we're very goal oriented, especially in the Western world. And so it's like, but I've got to get to here. And so being able to help people be able to create new meaning and be able to create new ways of relating and connecting.
For you, having a 9-year fertility journey that led to you being this very nurturing therapist, counselor, queen of grief. You have these dogs, you have their full practice.
Which doesn't mean that I don't have times that I'm very sad.
Right.
Which doesn't mean that I don't do parenting classes. Why would I do parenting classes? Because I don't understand. I don't know what that's like in my heart.
Yeah.
When I see a movie or a show that shows the birth of a baby, I still get teary. It still moves my heart, which doesn't mean that I'm not, quote, over, my grief. I think we have to really look at how we language that.
That's why this whole idea of a happy ending,
right?
It changes all the time. And one day you can feel like, oh, that was how our path unfolded, and we are happy despite how it happened. We're happy enough, or we're happy over here. We thought we were going over here, and we're over here now. And I'm going to consciously choose to be happy enough, and if feelings of sad come in, that's okay, and that is normal and natural.
Well, we equate "Are you okay?"
with you ecstatic?
There must be something wrong, right? So you can only be okay if you're happy and sad and happy and glad and joyful, right? Right. It's like, why isn't being teary and sad or down? Why is that not okay?
Yeah. Why does that mean that it wasn't a happy ending?
Yeah.
If we still have some feelings or lingering, or find ourselves thinking, daydreaming how it could have been.
Yeah. You look at, I love Megan Devine's work in her book of It's Okay That You're Not Okay.
Right.
Which is beautiful.
Right.
Yeah.
It might be that you just end up losing less time or energy to it.
I think we reinvest the energy
into some other dream.
Yeah. It's about reintegrating